How much will Medicare cost me? This is a common question. Folks want to know, well, how much am I going to have to pay for my Medicare and my health care and so forth? Because I thought Medicare was free. Well, there's a little bit of a rude awakening there. But whenever they ask about how much does Medicare cost, they're usually thinking in terms of monthly payment, because after all, we live in a monthly payment world. You make car payments, you make house payments, you make utility payments, and so you just kind of try to compartmentalize things and narrow it down to just how much am I going to have to pay each month. And that's okay for some things, but you need to expand your viewpoint a bit when you're looking at health insurance and health care. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, I had a lady contact me a few months ago, and she was a referral from an existing client. She lives in kind of a rural area about halfway between Chattanooga and Atlanta. And she said, I'm retiring. I don't have a whole lot of money, so I've got to really, really be careful with this. And I said, I understand. I'll go through your options and lay it out. And I said, if it's something that works for you, okay. And if not, well, you have to recalibrate, I guess. But anyway, so she in the course of the conversation, she mentioned that she was retiring because she'd been on her feet for 20 years and her knees were shot, and she was going to have both knees replaced as soon as she went on Medicare. And I thought, well, okay, this is going to be a little bit of an extra challenge to consider. And especially where you are, you may or may not be able to find somebody that's good enough, that's qualified in your area. You might have to go to either Atlanta or Chattanooga. And she says, that's okay. I drive. I'm fine with that. But I just need something I can afford. So I started talking about Medigap plans. And because you can go, since it's paired with original Medicare, you can go to any doctor, anywhere, any hospital, and you don't have to worry about, am I in network, am I out of network, is somebody going to say, no, you don't need this? So it's pretty straightforward. And I quoted her premium for a G plan, and she says, well, that's a little bit high. She said, but I think I could probably swing it. Does that include smoker rate? And I said, well, no. I said, most of us don't smoke. But well, I've smoked all my life, and I can't. I've tried to give it up, and I can't. So I said, well, that's going to add about $20 a month to the premium. And she kind of thought a minute, and she said, well, I guess I can do it. So anyway, we pressed forward, and I took her application and submitted it, and I thought everything was fine. And then about a month later, I got a notice from the insurance carrier. Well, she'd canceled her coverage. And I normally don't follow up with people because I figure, hey, you made up your mind, and then you made up your mind again. And it's not my job to try and talk you into doing something that you really don't want to do. But I did call her up, and I found out that she had dropped it because somebody had talked her into an Advantage plan where she didn't have to pay a premium and there wasn't a smoker surcharge. And I said, okay, all right, yeah, wish you best. So anyway, it kind of annoys me sometimes when people do this, because when she told me she had to have two knees replaced, I said, well, that's several $1,000s. But fortunately for you, with this plan, between original Medicare and the supplement plan and so forth, your out-of-pocket's going to be about $200 for the year. And she said, oh, well, that's really nice. I said, yes, it is. And so here she ends up dropping that plan and going with a plan where she's going to have to come out of pocket, probably several $1,000s in a relatively short time as she gets each knee replaced. And you just kind of shake your head sometimes. And, you know, I'm reminded, I have another video out there called Mr. Magoo Looks for a Medicare Plan. And there's a lot of folks out there that are nearsighted like Mr. Magoo. They can see what's up front, but they can't really see the big picture that's beyond the end of their nose hardly. And when somebody says, you know, well, I can't afford a Medicare Supplement plan, but this Medicare Advantage doesn't have a premium. And I said, well, you know, the Medicare Advantage plan's great until you have to use it. And I said, quite honestly, if you can't afford a Medicare Supplement plan, you really can't afford to get sick under a Medicare Advantage plan. And that's just the facts. That's not me talking through my hat or anything. And some people take heed and some people don't. And you know, I do my job to help people understand and you know, and kind of get the big picture. Sometimes it works, sometimes it doesn't. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.